I'm originally from Houston, Texas. So I went to school at Texas Tech University in Lubbock, Texas, and got my bachelor's degree in clinical psychology there. And then I went to West Georgia University in Carrollton, Georgia, and got my master's degree in humanistic psychology. And then I wound up at Nova Southeastern University in Fort Lauderdale, where I got my doctorate in clinical psychology. An issue that really was very paramount to my working with AIDS patients in the 80s is that because of the death rate around AIDS patients, as a psychologist, I had to be prepared for every person I worked with to die. And what I did in therapy is to help each person, I hope, help each person get to the point of understanding what the meaning and the lesson is in the illness that they had, or the AIDS that they had, and what effect that it would have on their lives as they were living it now, with the anticipation of their early death. And as a psychologist, I was dealing with chronic death and dying issues myself. So not only was I helping people deal with death and dying, I was having to deal with it myself as well. And that became pretty draining on a psychologist who was in the helping profession. The helping profession is usually to help people go on with their lives. At this point in time, my helping was helping people learn how to die at peace. And I've been in practice since 1986. I had a large practice in Fort Lauderdale, and I have a small practice in California. And because I live in an area called Santa Cruz, California, it is very similar to Fort Lauderdale because there's a huge gay population, primarily lesbian population there, but the gay male population is large. So there's a very similar attitude and frame of reference in both places. My experience with the beginning of the AIDS epidemic goes back to 1986. When I started my private practice, AIDS was just getting geared up. And in Fort Lauderdale, there were a large number of people with AIDS who needed therapy. And there was a clinic back at that time called Northwest Health Center that did a combination of services for AIDS patients. This is at a time when education about prevention, about how the virus was transmitted, was just coming out and just beginning to be evident as to how we can prevent AIDS from being spread, as well as how to deal with it. At that point, AZT was the only treatment of choice at that time, so it was expensive. And AZT in itself was lethal. It's a poison, and even though it was killing the virus, it was also killing people. What I found in the course of my doing therapy is that people have at least back in the 80s, not so much now, because it's not stigmatizing, but there was so much shame around being positive or having AIDS that the embarrassment, the fear, sense of shame that was so strong when people became diagnosed. It was pretty thick, even here. Even Fort Lauderdale, that has a very liberal attitude about a lot of things, there was a lot of discrimination with people with AIDS and people who were fearful of dealing with people who had AIDS. People didn't understand specifically at times how it was transmitted, and so there would be people ridiculing and rejecting people who needed help. That was a big thing. And also families would oftentimes reject an AIDS patient or a family member with AIDS or HIV positive. People who are working in healthcare, people who are working in the service industry, whether it's restaurants or anything like that dealt with handling food, were oftentimes fired. The discrimination and the things that were happening to people was just rampant. Out of fear, out of ignorance. And I believe that's what the World AIDS Museum is all about, in helping get rid of the ignorance around HIV, around AIDS, around treatment, and dispelling the fears that no longer have to be plaguing us. In the beginning, AIDS was a gay disease, a gay plague, and people reacted in such a negative way because of their fear of it being a gay disease. And people who were otherwise very intelligent, savvy people became emotionally crippled by their fear around it being a gay disease and how that might be spread to straight people and other people who might be vulnerable in terms of the healthcare industry. There's a lot of gay people in the healthcare industry that were discriminated against because of being gay. I believe what's happening today is because of knowledge. We know that knowledge is power. That the more knowledgeable people become, the less fearful they become, so the less discriminating they become against people who are HIV positive. The more we're able to help people live comfortably with being HIV positive, which is now a chronic manageable illness, much like diabetes. I think what happened is the fact that gay men are usually more highly educated or have higher SES, socioeconomic status, and are able to access information and knowledge easier. And I think what's happened is that because there's a huge population of people who don't have access to information and don't have access to knowledge, that helps fuel the HIV transmission in countries like Africa, where people, men and women and children, are becoming HIV positive because they're not able to be educated. They don't have access to medical care that we do have here. If you look at epidemics historically, the fear around epidemics was rampant. We all have to deal with our mortality, and oftentimes people who are diagnosed with HIV, at least back in the 80s, it was not a chronic manageable illness back then, it was a death sentence. That everyone who became positive developed AIDS regardless of the treatment at that time. It was only a matter of time. So back then you had people dealing with death and dying issues at very early ages when they should be building their careers. Instead they were planning their funerals. Not only their families were affected by this, but the person and their lovers or significant others were all in this boat together. So they were facing issues that they were not ready to face. Today, however, because of treatment, we're dealing with a chronic manageable illness. So the issues around death and dying, although they're there, are not as crucial and prevalent as they were in the 80s and 90s. When you're dealing with younger people, you have to deal with their ignorance around the fact that they're not invulnerable. And that's kind of tough because that's a developmental issue that all of us dealt with. We all were invulnerable at one time. But as we get older, we find out that we're not. Adolescents and young adults don't see that they're vulnerable in any way. And I don't think that their sense of being invulnerable was just related to this era around sexually transmitted diseases. I believe that that's true with all eras. Children and adolescents and young adults today can be educated about the fact that it is very real, that their sexual behavior is a risk unless they take precautions. One of the hardest things in dealing with adolescents and more adolescents and young adults is the fact that to have an open dialogue where kids can talk to their parents about whatever's on their mind, almost as if that they're good friends as well as parents. Because the fact is that if you have a relationship that's open with your child, that opens up those doors of communication, the lines of communication, the more that you know, the more that they know, the more your power you have between you in terms of your relationship, and the safer that they are, and the safer you are. In therapy, when I deal with people who are newly diagnosed and they're questioning how to tell people about their HIV status, one of the things that we talk about initially is their fear of rejection, their fear of being ridiculed, and the shame that they feel. And when we get through to the point of realizing that who they are as a human being is not only HIV positive, then there's a way that they can share that information with their sexual partners or their potential significant other that helps prevent the rejection. And that's a matter of just being unashamed and being point blank about their status. And if the person chooses to reject them, then they're a person they don't want to be with. And oftentimes relationships tip in the direction of having a problem, because there was a problem there anyway, and that the HIV might bring it out in a way that might not have been brought out otherwise. And the fact is that a lot of couples work very well in couples therapy in dealing with their fears and concerns and how it affects the relationship today and into the future. More hope now than we've ever had, and I believe that that is the thing that's going to get us through this epidemic, and that's going to get us through to the other side in order to help each of us in our lives and in our relationships, whether we're HIV positive, AIDS, or not. But the AIDS epidemic, what it's helped us learn is that ignorance is the thing that causes the most problems in dealing with this. The more that we're educated, the more knowledge we have, the less ignorant we are and the less fearful. And it's no different from the Ebola epidemic as well.